Picture this. You're in the hospital waiting anxiously as a loved one gets test results. The doctor walks in and says, "Your kidneys aren't working properly. You have acute kidney injury." You freeze. What does that mean? Is it serious? Can it be treated? The truth is, AKI can happen fast, and if not caught in time, it can lead to life-threatening complications. But here's the thing. Most people don't know the warning signs until it's too late. In this video, we're going to break it all down. What AKI is, how to recognize it early, the different types, and most importantly, how to protect yourself and your loved ones from this silent but dangerous condition. Let's get started. First, let's break down what AKI is. Acute kidney injury is a sudden decline in kidney function. This means your kidneys, which normally filter waste and excess fluids from your blood, aren't working as they should. AKI isn't a disease, but rather a condition caused by various factors that disrupt kidney function. It's important to note that AKI can develop quickly, within hours or days, and it's potentially life-threatening. However, with prompt treatment, it's often reversible. How do you know if someone has AKI? Here are some of the common signs and symptoms. Decreased urine output, producing less urine than usual, or no urine at all. Swelling, particularly in the legs, ankles, or around the eyes, due to fluid retention. Fatigue or weakness, caused by toxins building up in the blood. Nausea or vomiting, often a result of waste accumulation. Confusion or difficulty concentrating. This can happen when waste products affect brain function. Chest pain or pressure, caused by fluid buildup around the heart. If you or someone you know is experiencing these symptoms, it's crucial to seek medical attention immediately. Now that we know what acute kidney injury is, let's talk about the three main types of AKI. Each type has a different cause, which means the treatment approach also varies. Let's break it down. 1. Pre-renal AKI. The first type is pre-renal AKI. This happens when the kidneys don't get enough blood flow. Think of it like a drought. The kidneys can't function properly without enough fluid. Some common causes include dehydration from vomiting, diarrhea, or not drinking enough water. Severe blood loss or low blood pressure due to shock or heart failure. Treatment. The main goal is to restore blood flow to the kidneys. IV fluids are given to rehydrate and improve circulation. If blood pressure is dangerously low, medications to stabilize blood pressure may be needed. Treating the underlying cause, like stopping bleeding or managing heart failure, is crucial. 2. Intrinsic or intrarenal AKI. Next, we have intrinsic AKI. This happens when the problem lies directly within the kidneys themselves. Common causes include infections like glomerulonephritis, toxic damage from certain medications, contrast dyes used in imaging, or heavy metals. Prolonged lack of blood flow leading to acute tubular necrosis, ATN, where kidney tissues get damaged. Treatment. The priority here is stopping whatever is causing the damage. Medications that are harmful to the kidneys are stopped immediately. If an infection is the cause, antibiotics or antivirals are used. In some cases, medications that reduce inflammation, like steroids, might be needed. Close monitoring of fluids and electrolytes is essential, and if the damage is severe, dialysis might be required to support the kidneys while they recover. 3. Post-renal AKI. Finally, we have post-renal AKI. This type occurs when something blocks urine flow, causing pressure to build up and damage the kidneys. The most common culprits are kidney stones, enlarged prostate in men, tumors or strictures blocking the urinary tract. Treatment. The key is removing the blockage. In cases of kidney stones or a prostate issue, doctors might use procedures to break up the stones or reduce the size of the prostate. For severe blockages, a catheter may be inserted to drain urine. In some cases, surgery is needed to remove large obstructions or correct structural problems. Now, let's talk prevention. Here are some tips to keep your kidneys healthy and lower your risk of AKI. Stay hydrated. Drink enough water, especially during hot weather or exercise. Be cautious with medications. Avoid overuse of painkillers like ibuprofen or aspirin, which can damage the kidneys. Manage chronic conditions. Keep conditions like diabetes and high blood pressure under control. Avoid toxins. Limit exposure to substances like heavy metals and certain chemicals. Seek medical help promptly. If you notice signs of infection or other concerning symptoms, don't delay seeking care. To sum up, acute kidney injury is a serious but often treatable condition. Recognizing the signs early, understanding the causes, and taking preventative measures can make a huge difference. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Thanks for watching and take care of your kidneys.